So today we're going to talk a little bit about the GLP-1 agonists, commonly known as the weight loss injections. So we can't actually mention the names of the individual injections, but I think people know what we're talking about. So these are used once weekly in general. We're getting very good results with those, and I think they are a big advance in medicine for obesity and for the treatment of diabetes. But one of the things that we find with that is that people can often lose a lot of volume in their face. Their face then becomes very gaunt and skeletonized, and this then troubles them. So they've lost the weight, they've done great with that, but then they end up with this gaunt, skeletonized look in their face. So we can treat that, and what we use to treat that is a combination of things. We like to use a product called Sculptra on the lateral face. So that means out here on the lateral face to help to lift it, and even up into the temple. So this is what is a biostimulator, and it's made by Galderma. So it gives great collagen production, and it gives a great lifting effect. We'd often do one session and maybe do a session a month later. That generally gives a really good lifting effect. Now in the front of the face, where there's volume loss in the deep medial fat pads in the face, generally I don't put Sculptra in there. I like to bring Sculptra out this way, but in this area I tend to use a hyaluronic acid, one called Restylane Lift. That gives a good revolumization of the central face. So there's a combination of things involved tackling this problem of weight loss of the face. And then another thing that we do is we use our Cytone Skin Tight Laser, which tightens the skin around the facial areas and again helps with that lifting effect. So it's a combination of Sculptra in the lateral face, way out here, right up into the temple to lift, Restylane Lift in this area, and then the Cytone BBL in the skin tight mode to give you that lift up in the lower face. And another thing that I always mention as well, of course, is that we like to do the Nefertiti lift with our muscle relaxant injection along here, because we know that the overactive platysma in this area will pull the face down, and that will make things worse. So that combination of things is a good way of tackling the undesirable weight loss that occurs in the face after the use of the once weekly GLP weight loss injections. So that's how we counteract that. And, yeah.